Hey guys, welcome back to my channel. Tess here, and in today's video, I want to talk to you guys about the healthcare system in Italy. I know many of you will be moving to Italy very soon, and so it's best you know about the healthcare system, especially for students, and how it works over there. So let's get right into the video. Okay, guys, so the healthcare system in Italy is pretty good, and I would say it's somehow like one of the best in Europe, and it's pretty much available for everybody who is a resident in Italy, including the students. The healthcare system, so the obviously there is a private and health and pub private and public health insurance, but in today's video I'm mostly talking about the public health insurance, which is pretty much available for everyone. In Italy, how generally the healthcare system works is that it's a very affordable system generally, because like when you're working in Europe, or when you're working in most of these European countries, especially a country like Italy, obviously you're contributing to the healthcare system by the taxes that you are paying. So it's mostly covered by the taxes you are paying, and so the healthcare is somehow affordable or generally considered free, but obviously you are contributing to it through the taxes that you are paying. But then for the students, it's a little bit different, but there is an yearly fee that you have to pay, which is about 150 euro. But that's not a monthly fee, but an yearly fee. So for me, I find that affordable in Italy because, for example, like in Germany, you have to kind of like pay for your healthcare monthly. So if, for example, you're not working and it's not covered in your work is not generally covering for your healthcare, you have to pay a certain amount of fee monthly. So for like the students here, I know they pay a certain amount depending on the health insurance you're having monthly. But instead, in Italy, you pay an yearly fee of about 150 euro, and that covers for your health insurance the entire year. The health insurance basically depends on the region you're in. So it's like the regions in Italy are basically like in charge of the healthcare system in that particular region. So it's like depending on the region you are in, you have to go to like a healthcare center in that place and tell them that you want to apply for your insurance. They call it the tessera sanitaria. So you will get that in form of like the codice fiscale, and with that, I think when you pay for that, I think they will give you a list of doctors and you can choose from them, and that will be your personal doctor. So once you pay for your health insurance, you have the accessibility of having your own personal doctor and other health benefits. So you would choose your own doctor, and so that is the doctor who you will be under, or that is a doctor who will be in charge of you. So anytime you have issues, you have to go to that doctor. And so if there's any specific tests that you will need to do, your doctor is the one who is supposed to write it for you, and you have to go to the hospitals and get those tests done. So also you have accessibility of getting like certain tests for free. So there are certain tests that are covered in the health insurance, but then there are also certain tests that are pretty much not covered in the health insurance. So it depends, but most times you find that most things are covered by the health insurance. And then also when it comes to the medicine, so if for example you go to your doctor and they prescribe medicines, there are certain medicines that are also covered in the health insurance. So when you go to the pharmacy and you give them the receipt that the doctor gave you, so you don't have to pay for the medicines as well. But then again, that depends, because there are certain medicines that are not covered by the health insurance. Then also you do have the accessibility of like the ambulance. So anytime you have an emergency and you want to call the ambulance, that too is covered by your health insurance. And then also in situations where maybe you have an issue, your doctor is not in office, it's a night, and you need to go to the emergency. So that is also really not a problem. You can always walk in and out of the emergency, in case you're having situations of emergency and you need to go and get treated. So that is pretty much how the healthcare system works. So this is obviously covered mostly by the public hospitals, but in situations where you, for example, maybe have to go to private hospitals, then that is not covered unless you probably have like a private health insurance. But most part for the public healthcare system, then that is usually covered by your health insurance. So this usually covers most things, but the majority of things I know that most public health insurance don't really cover for is like um your dental care. So most times in Italy, it's like your dental care is outside of your health insurance. So for example, if you're having issues with your teeth or your dental care, then it's like most times you kind of like need to pay for that on your own. But then you have to confirm with your health insurance what is covered and what is not. And then also another thing also, this is very important, is that this health insurance is usually it lasts for like only 1 year. So it's usually January to December. So it always expires December 31st. So for example, if you go to Italy in September and you apply for the health insurance in September, it will only be valid until the 31st December of that particular year. So for me, my advice would be always to apply for your health insurance the beginning of every year, so you have like a whole coverage of a whole year and you don't have to waste money to pay for another health insurance come the following year. So that would be my advice, because if you apply in September, October, November, regardless of what time you apply, the health insurance expires the 31st December of every year. So just be aware of that when you are going to apply for your health insurance.